So we're going to continue with our Freedom from Pain program with Dr. Tong, Tong MD, and we're going to show the world that everything can be cured. All chronic ailment can be cured. And we're going to put in as many testimonies as possible. So with me today is Eric. Eric, why don't you introduce yourself? How did you find out about me and what you come to see me for?
Okay. Well, I had originally heard your program on the radio.
Yes.
And I was actually flipping through the dial to find the angel game, and I found the real angel.
Okay.
Right?
Yes.
So, previously, earlier in my life, a couple of years back, I had a mini stroke.
Yeah, that's right.
And so, when I was in the hospital, what they couldn't find anything wrong. They just said, look, you weigh too much, and you need to change your lifestyle. And they prescribed me 6 different high blood pressure medications.
6 high blood pressure pills.
Correct.
That's killing you. Okay.
Yes.
Yeah.
So then they sent me. So then for the previous 2 years after that, or the subsequent 2 years, what I did is I started researching things. I got into hiking. I was walking a lot more. Lost a lot of weight. But the more I kept learning, that, hey, look, the reason I keep going to give my blood every 3 months at Kaiser was because they were always checking my liver, my kidneys.
Yeah. That's what, to all the listeners out there, that's what you should follow what Eric does, okay? You cannot just rely on the doctor to heal you. You need to learn. You need to empower yourself with knowledge to heal yourself, because the medical profession only give you drugs, which is not good for your health.
Yeah.
So anyway, so what happened then with your program?
Well, then when I heard your program, one of the taglines I think you or Dr. Elaine had said was, "Look, if you're using prescription medication, you're killing yourself."
Exactly.
Right. That's what I heard, and so that's what stopped me on the dial.
It could be good for your symptom, but never good for your health. You put in chemical in the body does not use to sustain health. It never good for health. So don't let them fool you.
Yeah.
Anyway, so how were you feeling at that time with your hiking and exercise?
I was feeling better because I was lighter, for example.
Yeah,
than
but
I was
you
before.
still suffering.
But I started to feel some things, chronic things going on. Like, for example, when I would sit down with my family at night at the end of a day, up high in my back, in the rear back, I felt like it's a low-grade pain.
Yes.
And I knew that that's where my kidneys were.
Yeah.
And then I think I'm just putting 2 and 2 together between everything I read, and then knowing where the kidneys are located, and then watching the blood tests when they're always looking at my kidneys, right? Every time I take blood at Kaiser.
So what are they going to do for you? This is the whole point.
Well, that's the thing.
Yeah. What are they going to do for your kidney? Okay.
Yeah.
Nothing.
Yeah. So what I deduced, right, in my own mind was that the reason they're looking at my kidneys is because they want to see how fast they're killing me.
Yes, exactly. Okay. All right. In fact, I want to add this. Not only they are not doing nothing. Okay, they're not doing anything to your kidney. They're killing the kidney and the liver. The liver first, the kidney second, with all the chemical. Prescription drug are chemicals. Doesn't matter when you legalize it. It does not minimize, does not reduce the chemical toxicity. Yeah. So you feel the pain here. What else? What else you feel?
I was also and I didn't know that these were related in any way, but every night I couldn't get 6 or 7 hours of good deep sleep because
everything's related.
Everything's related.
Yeah.
But I would have to wake up and go to the bathroom.
How often?
Every night between 1:58 and 2:04 a.m. It was like clockwork. It didn't matter if I fell asleep at 10. If I fell asleep at 12, at that time I'd have to wake up and go use the restroom.
Okay, so how often? How many times at night you would go?
At least during that time, and maybe one other time, but it was consistent. I could never get a full night's sleep.
So how many times? How many times a night?
At least twice.
At least twice. Okay.
Yeah, at least twice.
Okay, all right.
During sleeping hours.
And you're young. You're not even 50.
No, I'm 45 years old.
Yes.
44 at that time.
Okay,
right?
all right, okay.
So, that was an issue that I had as well. And so when the first treatment with you,
yes,
you told me, we're going to let you heal you. That's what you told me, and I didn't know what that meant.
Yeah.
And I got one treatment, and that night I went home, and every night since, and, I don't have to get up and use the restroom
Okay.
at all.
Let me explain what I did, okay? All we do is enhance the body's own healing power. When you have enough healing power, you don't get sick. It's just like when a business have enough money, you won't have any problem. Money is to buy healing power, buy qi, what the Chinese call qi, living human power, okay? Anyway, so I improve his kidney qi. The kidney qi controls circulation to the kidney and to the bladder. When the bladder is not having enough circulation, it's not resilient. So instead of feeling 500 cc, you feel distended, 100 cc, you feel distended. So you go to the bathroom 5 times. That's why you have to get up at night. So I improved your kidney function, and right away, you stop going to the bathroom. When I was having some prostate problem, my PSA was 11. I was getting up about 8 times a night, 8 to 9 times. Now I hardly get up 1 or 2 times, 1 time or 0. Anyway, so how about the pain in the kidney area? Did it help?
Yeah, it did. That was probably after maybe 3 or 4 treatments.
Yeah.
The pain completely went away.
Yes.
Has been gone ever since.
Okay, then how long
I don't
was that?
feel it. That was probably at least 6 months ago where the pain stopped.
Yeah, that's what we mean by curing the problem, okay? He doesn't come back. I don't have to give him persistent treatment. He's still coming for other issues,
Sure.
which have to do with your gallbladder and liver
Correct.
and your diet.
That's correct.